My name is David Matute, and I will talk about vitamin D supplements and prevention of cancer and cardiovascular disease. Well, we have definition. Vitamin D, also called cholesterol. This vitamin is one of the fat-soluble vitamins essential for the normal formation of bone and teeth, and for the absorption of calcium at the intestinal level. Cancer is started when cells grow out of control outnumber normal cells. Cancer can develop anywhere in the body. Cardiovascular disease called a group of disorders of the heart and blood vessels. They are classified in high blood pressure, coronary heart disease, myocardial infarction, cerebral vascular disease, stroke, and others.
Cancer is a group of over 100 diseases characterized by abnormal, uncontrolled cell growth. In a healthy body, cells grow, die, and are replaced in a very controlled way. Damage or change in the genetic material of cells by environmental or internal factors sometimes results in cells that do not die and continue to multiply until a mass of cancer cells or a tumor develops. Most cancer-related deaths are due to metastasis, malignant cells that penetrate into the circulatory system and establish colonies in other parts of the body. Great advancements have been made, but cancer is still the leading cause of death for people under the age of 85. In the United States, 1 in every 4 people die from cancer.
Cardiovascular disease involves abnormalities of the heart and blood vessels. Coronary heart disease is the most common condition and is the leading cause of death in the United States for both men and women. The lifetime risk for developing significant cardiovascular disease is greater than the likelihood of developing cancer. Your heart is a muscular pump that requires heart arteries to supply oxygen-rich blood to keep it going. Coronary heart disease occurs when these blood vessels become narrowed due to a buildup of plaque. The plaque is made up of cholesterol and other substances. This process is called atherosclerosis. Atherosclerosis occurs over a lifetime and is influenced by risk factors. Some risk factors can't be changed. However, others can be altered through healthy lifestyle choices and medications if needed. Symptoms of coronary heart disease occur when the heart muscle does not get enough oxygen. Some describe this as chest pressure or chest pain that starts over the left chest and can radiate or travel to the left arm, left jaw, back, or sometimes to the right chest. Some patients do not have any chest pain or pressure symptoms, but instead have intense shortness of breath or epigastric discomfort that can feel like a bad heartburn. Breathlessness, nausea, vomiting, or sweats can also sometimes be associated. These symptoms are called angina. There are many treatments for angina, including medications, angioplasty and stents, and bypass surgery. Aggressive risk factor modification is part of every treatment plan. Coronary heart disease can have serious complications, including heart attacks and even sudden death. Fortunately, developing significant coronary heart disease is largely preventable. Early prevention is best, but you can still improve how you'll do, no matter how old you are, by reducing your risk factors. One study found that 50-year-old people who had not already developed significant cardiovascular disease and didn't have major risk factors reduced their lifetime risk for developing significant cardiovascular disease, and they live longer. Continue on through this section to learn more.
Well, with the application in medicine, let's start by pointing out that the use of vitamin D didn't lead to significant difference in any of the secondary cardiovascular endpoints or in the rate of death from any cause in the overall cohort or in subgroups. The supplementation with vitamin D3 didn't lead to a significantly lower incidence of in-base cancer of any type or a composite of major cardiovascular events than placebo. A post-hoc analysis of the rate of death from cancer suggests a possible benefit with respect to the rate of total deaths from cancer after excluding of early follow-up data, based on a use 95% confidence interval that doesn't include one. The results of subgroups analysis raise the possibility of differential effects or cancer incidence according to BMI, with normal weight participants who receive vitamin D having a lower incidence than those who receive placebo. Tested daily with vitamin D plus calcium and gain placebo for cancer prevention showed a suggest but not significant 30% lower incidence of cancer in association with the active intervention. With pros and cons, we have prevents fatal resolution in a patients with cancer and cardiovascular risk disease. Strengthening the immune system helps prevent respiratory system in addition to having benefits in fighting skin afflictions. Has an impact on good cardiovascular function, maintaining neuronal development, helps cognitive function. Outcomes, I don't see any relevant problem. Body supplements that can be expensive and believe that this can cure cancer. Now with the application, Dr. Jimena Hidroff and colleagues said it is a subject that a drug that acts like vitamin D could help prevent colon cancer by activating the vitamin D receptor and removing CLA from the body. La Universidad Pontificia Católica del Ecuador said in case of needing supplementation, the recommended dose is 400 international units per day, prescribed and controlled by a competent health professional. Generally said, consumption is not recommended. Some exposure to sun is generally recommended and at least 3 days per week in hours and days of low ultraviolet radiation, avoiding areas with risks of contagion of COVID.
The anti-cancer benefits of vitamin D have been known for a while in a laboratory setting, but now a recently published study shows potential vitamin D benefits in patients diagnosed with metastatic colorectal cancer.
So we are very encouraged by the results of this trial.
Dr. Kimmy Ng says the phase 2 trial studied 139 patients. They all received chemotherapy, but then at random were either assigned a standard dose of vitamin D equivalent to what you'd find in a multivitamin, or a much higher dose of vitamin D equal to 10 times the standard dose.
Patients receiving the high dose had an average progression-free survival of 13 months compared to only 11 months for those who were receiving the lower dose.
Dr. Ng says that although the difference in average survival of 2 months may not seem like a long time, there was an overall 36% improvement in progression-free survival throughout the course of the study, just by taking a supplement that is relatively inexpensive and accessible.
In this era of rising healthcare costs and potentially some very toxic drugs, vitamin D represents a really important potential advance in the armamentarium of possible treatments.
Dr. Ring says patients in the study didn't have any serious side effects from the vitamin D, even at the higher doses. She also says this study helped confirm how much vitamin D is needed to get patients out of a deficient range. An important finding because most metastatic colorectal cancer patients are vitamin D deficient.
The big takeaway from this study is that vitamin D supplementation may have a role in the treatment of patients with previously untreated metastatic colorectal cancer.
Dr. Ring says no one should be taking these higher doses of vitamin D outside of a clinical trial. More research is needed, and this study paved the way for a much larger Phase 3 trial. For Dana-Farber News, I'm Victoria Warren.
Now, in conclusion, I could conclude that supplements doesn't cause any significant benefit with respect to cancer incidence, but a significant benefits with respect to cancer death rate. Daily supplementation with a high dose of vitamin D for 5 years among initially healthy adults in United States didn't reduce the incidence of cancer or major cardiovascular events. Thanks.